Thanks to everyone for joining today. My name is Cliff Campbell. I'm a product specialist with StellaLife. I've been with the company for a little over 4 years now. It's been a really fun experience. This company is so unique. Our products are very unique. Just a little bit of our background, the research behind the products actually started in the year 2000, and it took us 15 years to come to market with a product we were really confident was going to, make a huge difference in the industry. So we've been selling product for about a decade now. We've grown so much in just the short time that we've been around. And I think we can really attribute our growth to not only the great results that doctors are seeing on a regular basis, but also the patient experience. I get phenomenal feedback from all of my customers very regularly about how much their patients enjoy using these products. And I think that's half the battle. You want to give your patients a good experience and you want to have a really good outcome. And with the StellaLife products, you're going to get both of those things. So in today's presentation, um, we're going to be covering why StellaLife. Why should you be using this product and recommending it in your practice? We're going to be talking about the science behind the products, all of the various studies that StellaLife has done over the past number of years, procedures and applications that StellaLife works well for. The cool thing about this product is there are so many different applications, both surgical and non-surgical. So we'll be talking about a lot of those today. We'll talk about how to incorporate it into your practice. We always recommend stocking it if you are a dentist. Stocking it in your office, it's a lot more convenient for your patients if they just walk out of the door with it. And then you know that they're actually using it. If you're telling them to go buy it online on Amazon or something, you don't actually know who's using it, and then you can't really rely on the predictability of the healing that you often see with our products. And then we'll talk about two of our newer products, some really exciting things regarding our probiotics and Dentamedica. These are products that we've come out with in the past few years, but have really been showing a lot of growth. And I think that's because the results have been amazing with these products as well. But the overall point of today's presentation is really just to see how StellaLife can elevate your practice. So please, if you have any questions while I'm presenting, please feel free to interrupt and ask. But we'll also have time for a Q&A at the end. Stelli's mission, as I said, we started in 2015. We were launched on a mission to improve people's lives by accelerating healing, relieving pain, and doing that in a drug and opioid-free environment. So we have products that outside of our rinse that are replacing chlorhexidine and really providing a great antimicrobial effect for your patients. We have products that go beyond that, really trying to attack pain and inflammation, treating the root cause of pain, which is inflammation. So we'll be seeing how StellaLife can really help pain today in today's presentation. And just to give you an idea, we have thousands of dentists dispensing our product across the country, hundreds of thousands of patients who have used our product and been very happy with it. We have also a very high rating on both Trustpilot and Amazon. One thing I always encourage is, go look and see what patients are writing and reviewing our products. We have some great feedback just on the internet. So highly encouraged to go look at those. But we've also we're a highly awarded product. We've gotten the top oral healing product by Dental Advisor the past 7 years, 2019 through 2025. And we're really trusted by a lot of the key opinion leaders in the industry, such as Michael Picos, Richard Myron, Seattle Study Club, a lot of different study clubs, different organizations that want to be on the forefront of new technologies in dentistry. And StellaLife is one of those products. It's pretty amazing. So just running through the products kind of on a high level real quick. So we have three different flavors of mouth rinse. So our mouth rinse is our antimicrobial product that's replacing chlorhexidine. Cool thing about StellaLife is we have different flavor options for your patients. So we have a peppermint flavor, a spearmint flavor, and a coconut flavor. All of these products have the same base for antimicrobial ingredients. So from an antimicrobial standpoint, they are all doing the exact same thing. Controlling bacteria the exact same way. The peppermint and spearmint leave a nice, refreshing taste in your mouth, which a lot of patients expect when they're using a mouth rinse. Now, the coconut is a little bit special in that we formulated that one specifically for patients that are sensitive. So, patients with lichen planus or burning mouth syndrome, really anything that makes the mouth overly sensitive, this can not only be a great post-operative mouth rinse for these patients, but also a long-term mouth rinse. Same goes with all of our mouth rinses. They are so gentle on the soft tissue and really have that selective cytotoxic effect, kind of very stealthy in the mouth. I'll explain what I mean by that later on in the presentation, but um, we also have the gel. The gel is used for pain and inflammation post-operatively. You basically just apply this using a Q-tip on and around the soft tissue of the affected site. After you apply the gel, you get about 3 to 3.5 hours of pain control. So we could be talking about an extraction site, some type of sore or ulcer in the mouth. Um, the gel is very effective at not only taking away the sensitivity, but also healing these sites quite a bit faster. So another thing that I'll be talking about in today's presentation. And then the recovery kit. The recovery kit has three products in there. It's a rinse, a gel, and a sublingual spray. So all of our recovery kits as of right now come standard with the peppermint rinse. The added component in here, which we do not yet sell separately, is the sublingual spray. And the surgical kit is really what we designate for oral surgery. You know, any extractions or implant placements, you know, all on fours or any type of augmentation procedure that you're doing. The sublingual spray has the same ingredients as the gel meant for pain and inflammation. Both of these products have 12 active ingredients, but the sublingual spray, you're delivering these ingredients a different way to your body. So you're spraying it sublingually, it's getting into your bloodstream and working systemically. So working from the inside out, as opposed to our gel, which is working from the outside in. So very powerful for these more traumatic surgeries where you know there's going to be a little bit more pain associated with that. But just overall, you know, we have outside of the products that I just discussed, we have Dentamedica, which is a vitamin supplement, really meant to build up vitamin levels leading up to the surgical procedure. And I'll have a few slides on that. Well, I'll talk about it in more detail later on in the presentation, but also probiotics. This is a very unique solution. I don't know of another company out there that is grouping up both a oral and a gut probiotic all in the same kit. So very effective for these autoimmune patients or you know your gingivitis patients that are going through SRP. Seeing our doctors are seeing even better results faster when they're using probiotics. So really, when we're talking about applications, you know, any type of surgical applications, you could use one or a combination of the different StellaLife products based on what you're doing. But non-surgical applications, just know that all of our rinses can be used for dry mouth and xerostomia. They are all naturally sweetened with xylitol, so very effective for these patients. And I've heard from a lot of my customers that this is the most effective rinse that they've ever stocked in their offices for dry mouth. Now, every patient is different and reacts differently to different products, but I would say this is a great first one to try if you have a new dry mouth patient. Now, oral inflammatory conditions, as I said, like burning mouth syndrome, all of these sensitive patients, you really want to be encouraging the coconut rinse, as there is no potential of any discomfort while they're using it. And then dry sockets, you can place the gel inside of a socket. It will help relieve that pain. Canker sores, cold sores, sores associated with dentures or braces, herpes lesions in or around the mouth. All of these things you can effectively treat with the gel. And it's not only taking away the sensitivity like a numbing product would do, but StellaLife Gel isn't numbing. As I said, it's really just an anti-inflammatory, but it is healing these sites much faster. And that's the added component that you don't really see with many other products out there. It's healing these sites in just a few days, you know, most of the time. So really, you know, a huge amount of applications and I never have a doctor saying, "Hey, Cliff, this product has been hard to sell." You know, most of my customers are going through their products fairly quickly because you can use it for so many different things. So getting into the science, so this is kind of the first major study that was done by Bern University, which is a research institute in Switzerland. Very prestigious university, does a lot of different studies in a lot of different areas. But this one was done by Dr. Richard Meyer, and Dr. Michael Picos was also involved in this study. They wanted to directly compare StellaLife with chlorhexidine and see how these products affected fibroblasts. So fibroblasts are very essential in the healing phase, and that they produce and move collagen in the mouth. So they bring about cellular migration, proliferation, gene expression, collagen synthesis, all of these things that we need taking place when the mouth is healing. If you're inhibiting these cells in any way, shape, or form, we've found that it's really going to delay the healing process. And that's why doctors are seeing such a significant difference in healing when they transition to using the StellaLife products. The soft tissue is healing much faster. Their wounds are closing much faster. And this is closing the door for postoperative complications. Um, you can see just after 10 seconds in the chlorhexidine environment, uh, the red color represents that the cells have died. You can see just after 10 seconds, it completely wipes out all the fibroblasts. Whereas in the StellaLife environment, they stay viable for, a fairly significant amount of time, certainly longer than our rinse time, which is just 1 minute. So we know that in the 1 minute rinse time, we are preserving these cells, allowing them to do their job, proliferate in the mouth. And that's why we're seeing, these really great healing results so regularly. This is another study out of University of Texas, San Antonio, the Perio program there. Dr. Georgios Katsakis, who used to be at UT San Antonio, but this was in this study they did what's called a scratch wound assay. So they get a petri dish. This was an in vitro study, fill it full of fibroblasts, and they scratch down the middle. So these dark gray areas you see represent the cells, and then the black is the scratch that they made. This is trying to mirror what an incision wound would look like under a microscope. So they have these different things that they introduced to the environments, different rinses. So we have the control, which was sterile saline, chlorhexidine, and then the StellaLife rinse. So in the control, you can see some pretty good activity happening here. We know that sterile saline is not does not affect fibroblastic activity. Chlorhexidine, you can see that it had a major negative effect on these cells. It allowed for zero cellular migration whatsoever. You can actually see that this gap actually increased by a little bit. So it made the gap wider. Definitely not what you want to see and definitely not conducive to wound healing. The StellaLife environment, on the contrary, by hour 24, you can see these walls starting to move in on one another. And certainly by hour 48, we're seeing even better proliferation of these cells and faster movement than what's happening in the control environment. And what they concluded was that these cells might actually really like these natural ingredients and move faster and proliferate at an even higher rate as a result. So really just confirming what we're seeing on a regular basis, which is that patients are healing faster using our products and wounds are closing up faster. Another study out of University of Indiana, whereas these other two were talking about our rinse, this one really focused on our gel. So it is different active ingredients between the two products. In our rinse, it's 4 antimicrobial ingredients. In our gel, it's 12 active ingredients meant for pain and inflammation. But they wanted to see, did the gel affect fibroblasts since it does have different active ingredients? What they found when comparing all four of these products, chlorhexidine, providone, iodine, and a different gel called AO gel, StellaLife was the only product that had no effect on fibroblasts. And so we know that across the StellaLife products found in the recovery kit, um, all 16 active ingredients, none of them are affecting fibroblasts. And that's really the key here. So we know that StellaLife is very good at preserving good bacteria. And that's why again, we're seeing these great results on such a regular basis. Now we want to make sure in regards to bad bacteria, how effective are we at killing bad periopathogens? So In this study done by Rutgers, they produce a lot of different research, very prestigious university. This one was accepted in April of 2025, so very recently. But in this one, they looked at F. nucleatum and P. gingivalis, two of the worst periopathogens. FN, as we know, is really can be a major transporter of other, negative or really bad periopathogens to other parts of the body. And P. gingivalis as well, just very, very bad periopathogen. We found that with one application of StellaLife rinse, we're inhibiting FN for 12 hours and P. gingivalis for 96 hours, which was, really surprising to them. And again, just another reason why we should encourage patients to use these products long term. It's really going to help them build up not only their good bacteria levels and retain their commensal bacteria levels, but also inhibit these really harmful periopathogens. So really allowing these patients to maintain a much healthier balance of bacteria in their mouths long term. And we also showed much lower toxicity towards commensal bacteria, as I said, is very, very important. And when compared to Listerine as well, so they were looking at both chlorhexidine and Listerine in this study. Listerine is also highly toxic to commensal bacteria. But what was also very surprising is StellaLife's ability to break up biofilm and have these really strong anti-biofilm effects. As we know in gingivitis patients or patients that are really struggling with their oral health, they're struggling with biofilm. If we can get a product that's going to break up the biofilm, it's going to make brushing more effective. It's going to make water picking more effective, flossing more effective by breaking this up. And that's actually why we recommend start using these products before the procedure. With our recovery kit, we have what's called the 333 program, which is starting 3 days before the procedure. I'll explain that a little bit more a little later on in the presentation. But I've heard from hygienists that, before an SRP, if their patients are using our rinse, for instance, it's making the procedure easier. It's making the procedure faster. The patient's bleeding less. They're getting less inflamed in the procedure. So a lot of benefits to starting before. By no means is that a requirement. Even if they start same day, they're still going to get the benefits. But we always encourage patients to start before the procedure. Um, Another really great thing about Cell Life, we've been effective in these autoimmune patients that have tried, many different products. Oral pemphigus, for instance, very uncommon. Probably most of you on this call have never seen this before. Unfortunately, it is becoming more common over time. But this was a perio student. Um, Out of Loma Linda, and he actually came up to us at a big conference, and he showed us pictures of this patient and asked if we had anything that could potentially help them. So what we did is send him some free products. They actually used three recovery kits on this patient. One was used a month before SRP. This patient was too sensitive to even perform SRP on. So they gave him the recovery kit 1 month using the recovery kit with the coconut rinse. As I said, with any sensitive patients, you want to make sure you're using the coconut rinse. 1 month was enough to really get this patient in a state where they could actually do the procedure. They were comfortable enough to do the SRP. And then afterwards, they spent another 3 months using the recovery kit. By that time, their mouth was looking much, much healthier. And after that, 3 month period post SRP, they just went to the rinse and started using the rinse on a daily basis, just kind of as a maintenance tool. Whenever they had, some soft tissue sensitivity, they would use the gel on that area, but nothing was very significant after that time. There was actually, unfortunately, a 2 week period where this patient could not access the coconut rinse because I think we were out of stock on Amazon. She started unfortunately getting some of these same side effects. So for these autoimmune patients where they've shown success using the StellaLife products, utilizing these products long term, even for the rest of their lives, is probably in their best interest. And another interesting study out of Stony Brook. This one was pretty interesting. Not something I would want to be a part of, as it was 40 dental students. They divided them into two groups of 20. Um, these students were not allowed to brush for 2 weeks. They were only allowed to use either chlorhexidine and or StellaLife. So what they did was take salivary samples before and after they started this study. And what they found, uh, you can see after the 2 weeks, visually, what do you think your patients would rather their mouth look like after using a product? Obviously, the StellaLife side, you have zero negative side effects, no staining. You can see the soft tissue looks much healthier. But in regards to these salivary samples, they were looking at their, their bad bacteria loads. There was no statistical difference actually between the StellaLife students, the students that use StellaLife versus the students that use chlorhexidine. So again, even over a period of time, we're seeing that StellaLife can have the same efficacy as chlorhexidine without any of the negative side effects. And a very cool case study done by Dr. Walter Tatch. He's an oral surgeon up in Chicago. He wanted to see, as I said, our mission is to improve people's lives by accelerating healing and reducing the need for opioids and steroids. So we really wanted to prove that we could do that. And Dr. Walter Tatch in 2015, before he started implementing StellaLife, you can see that he wrote quite a few opioid prescriptions in his practice because his patients needed it. They were in a lot of pain, and he didn't want them to be uncomfortable. But in 2016, once he started implementing the StellaLife products, in just a 2-year period, he saw this number drop by 73%, almost a threefold decrease in his practice. And I think that number is even up to 90% today, or even over 90%. He found that by using the recovery kit along with just over-the-counter, acetaminophen, this was more than enough to handle the majority of his patients' pain levels. And I'm sure if you guys are doing, same procedures as an oral surgeon, probably some of the more traumatic procedures within dentistry, even those very traumatic procedures are not requiring an opioid. And if we can get away from using opioids, we know it's such, a leading cause of death for so many age groups here in the U.S. So if we can get away from using these strong pain meds, we should definitely try and do that. This is another study done by Dr. Cameron Lee and John Suzuki. Their main goal here was to really see by starting the StellaLife products before the procedure. As I said, that's something that we recommend with our recovery kit. Starting before the procedure, they wanted to see was this delivering any benefits to the patient. And so all these patients were undergoing bone block graft surgeries where they were harvesting bone from one part of the mouth, rebuilding a ridge in order to place implants. Very painful surgeries as there are two surgical sites. And all of these patients or half of them got the recovery kit, half did not. And what they found in the StellaLife patients is that by starting before, these patients were actually getting a preemptive analgesia, basically controlling pain even before it happens. And postoperatively, in those first 2 to 3 days when the pain levels are usually at its worst, the StellaLife patients were not only taking less opioids postoperatively, they were also experiencing much less pain. And that's really due to the preemptive analgesia that StellaLife is providing if patients are starting before. So they're reducing the bacteria load, which is very positive, but also getting that preemptive analgesia. Um, just some other types of bacteria that StellaLife is effectively killing. Big one on here is strep mutans. As we know, strep mutans is one of the main contributors for plaque buildup in the mouth. So, again, this is a phenomenal long-term mouth rinse. I've never had a doctor say, "Hey, Cliff, ever since I started recommending your products as a daily mouth rinse, I've started seeing more issues." If anything, it's the complete opposite. If you start using these products in your practice, I get the feedback all the time that patients are coming back wanting to purchase more, and you can absolutely encourage that. And there's very few mouth rinses that are going to be as gentle, but also as effective as the StellaLife products. Um, This is another study done by Dr. Scott Fromm, and this one he wanted to compare the use of magic mouth rinse for treating canker sores compared with our gel. As we know, magic mouth rinse is just really kind of numbing things in the mouth, so it's not really helping them heal any faster. And what he found with magic mouth rinse, it was taking an average of 10 to 14 days to heal canker sores. Whereas with the StellaLife gel, if you're applying it roughly 4 to 6 times a day on the site, canker sores are going away in about 2 to 3 days. Um, I can tell you that I get feedback sometimes that if you can catch it even before it shows itself completely, it's going away in less than 24 hours. I can't promise that's going to happen every time, but I have gotten feedback from different offices, like their staff, that are really prone to getting canker sores. It's like a magic eraser. I have orthodontists that aren't necessarily, you know, not maybe many areas where they can use, say, our rinse, but the gel they keep in stock for any type of oral lesion, and they just send it home with the patient, and they can use it as often as they want. Um, Another study on nitric oxide. This is a really hot topic in dentistry right now. Nitric oxide is actually one of the main ways it's produced is in your oral cavity, and it plays such a major role in our cardiovascular health as it really helps to expand your blood vessels, making blood flow more easy in your body. So if you're killing your nitric oxide, like so many products do out there, in this study they found that chlorhexidine was highly toxic to nitric oxide, and also oxystome. These products are killing the bacteria that produce nitric oxide. So we're talking about a patient with cardiovascular issues, and there are so many patients with that issue, this could pose a major risk to them. There's been studies showing that killing your nitric oxide, using a rinse that kills your nitric oxide, can elevate your blood pressure even up to 20 to 30 points. So could cause a heart attack for these patients. So Stella Life has no effect on nitric oxide, and really should be seen as a safe product for these patients. Just a quick video, real quick. We'll watch from Dr. Michael Picos. In case you haven't heard of him before, he is a very well-known surgeon, oral surgeon. He has what's called the Picos Institute, where he holds courses throughout the year covering a wide range of subjects. But he always likes to talk about Stella Life as it's been such a game changer in his practice. And here's just a few words from one of his presentations.
There's a 333 regimen we talked about. It's very impressive. Here's a typical V-plasty with Eloderm. Time zero, there's 5 minutes. Hemostasis is like boom, amazing. But keep gauze on it for a good 4 minutes by the clock. That's the key to low compression, and let it soak in, and bingo. Here's a case of just cytoplast over extraction sites. Again, tissue is beautiful, responds very, very nice. And then here's our typical, 48 hours later, that's what things look like. Very typical. It's amazing.
So you can see the really great healing there
There's a 333.
just after 2 to 3 days. It's incredible. And then another thing that you heard Dr. Pico say is that hemostasis happens very quickly after you apply the gel. So it's really convenient to keep a few in your office, and just apply those immediately post-op. You can apply it after your SRPs. You can apply it after your extractions or implant placements. For more of you cosmetic doctors, before like a crown prep, for instance, if you're really trying to control that inflammation. So can be applied before and or after procedures. So really convenient just to keep chairside. Now, looking at some pictures, pictures are always fun to look at. This is this was a split mouth study, actually. This was a full mouth extraction and bilateral sinus lift where they applied the gel. I'll let you guess which side. They applied the Cell Life gel on this side immediately post-op, did not apply anything on this other side. You can see the strong anti-inflammatory effect just after 40 minutes. So with the gel, the key is waiting 15 minutes before eating or drinking anything. You got to give it time to absorb into the tissue. But just after 40 minutes, look at the impact. Bleeding stops, swelling goes down, and the patient feels that decrease in pain because of it. Again, immediately after the surgery, applying the gel just 40 minutes after. You're seeing a lot of the same things you saw up here. So very safe to use with any, biologic bone graft membrane. I also sell bone and membrane, so I know that StellaLife works well with any type of membrane in the mouth, even ones that you're leaving exposed, where chlorhexidine would not be, good to use when you're leaving something exposed. StellaLife is very safe. Even when doing this. And then this is a mandibular cyst extraction. You can see just after 1 week of healing what we've done for this patient. It doesn't even look like a surgery was performed there. And then this really shows the consistency of the gel. It's very viscous. It spreads out really nicely and evenly on the tissue without much effort at all. And what you want to tell the patient is just use a Q-tip. You really just want to glide it over the site as opposed to applying any pressure. So you'll kind of see that here.
Well, for attach here, this is a case of all in six reconstruction with immediate temporization. We're going to apply right after the surgery still life Vega oral gel over the surgical side with the suture line and then the vestibule. We bring the patient back 15 minutes later for delivery of the temporary prosthesis, where we're looking at the soft tissue a week later. You can see the tissue is already responding very, very nicely. Well, for attach.
So with the gel, it really doesn't take much at all. The gel should last just as long as the rinse. And in regards to the sizing of all of our products, so our rinse is actually 16 ounces. All you need with each application is 7 to 10 milliliters. Every one of our rinses and recovery kits come with a measuring cup. The second to bottom line on that measuring cup is about all you need with each application. So if you're telling your patients to use the minimum amount, it will last longer. So if they're using it as a daily mouth rinse, for instance, it will last about 40 days. If they're using it 3 times a day, again, which is what we recommend pre and post operatively, before and after surgery, it will last about a month. So the regimen here is rinse first. You always the rinse time is always 1 minute, and then they can spit that out, and then immediately after, you don't have to wait any time. They can use the sublingual spray and spray that 4 times into the tongue, and then applying the gel using the Q-tip on and around the soft tissue of the affected site. You could just go right along, the suture line. Um, but this is exactly what's printed on the side of our recovery kit. So very clear instructions for the patient on how to use the products. If you can get the product to them before, say, once they accept treatment at their consultation, give them the product, maybe send them a reminder text a few days before saying, hey, start using your StellaLife products today. But 333, starting 3 days before, using all three products 3 times a day. I always encourage patients to continue using the products until they run out. Again, it's only benefiting the patient to continue using these products. We do say a minimum of 10 days, so they want to at least keep using it 1 week post-operatively. SRP patients, this is a phenomenal product for SRPs. Recovery kit works great for these patients. If they can start before, I've heard from hygienists that even starting, a week before, they're seeing even it's making the procedure. Sorry, is there a question? Sorry, I just heard something, but Uh, use this as a pre-rinse in your office. I always encourage keeping a couple flavors on your shelf. It's nice to have flavor options for your patients. Not everyone has a preference. Some patients don't like coconut. Some you're going to have very sensitive patients that can't handle one of the mints. So I always encourage using this as a pre-rinse. Your patients can really decide which flavor they like the most. But yeah, use it chairside after SRP, applying the gel along the gingival margin. And a lot of hygienists I know are also irrigating with our rinse, and that is, very safe to do as well. Um, and then, especially for these patients, I would really say use the rinse until it's completely gone. Use it for that full month. And I have heard kind of the sweet spot is maybe having them use it for another month. So a total of 2 months post SRP. That's what I'm really hearing is the perfect amount of time. So Some other applications, bad breath halitosis, our rinse along with our probiotics kit, which I'll be talking about here in just a sec. Um, Dry mouth, as we've talked about, you know, every dry mouth patient is different. The more severe dry mouth patients may have to rinse, 3 to 5 times a day. Just tailor the treatment towards the patient, whatever works for them. And then some are, having to rinse a lot less, and it gives them enough relief. But we've talked about dry sockets. You can literally place the gel inside of the socket, and it will help relieve that pain. Denture patients, if they have any sore spots where the prosthesis has been rubbing up on the soft tissue, they can literally put the gel in their tray or in their denture before they put it in. That should give them relief throughout the day. And then any patients with braces, retainers, aligners, any lesions caused by these um, different contraptions, they can certainly use the gel for those areas, and it will help clear these things up faster. Looking at lichen planus, as we know, lichen planus is very hard to treat. Unfortunately, there is no cure for lichen planus. I know there's many different types. Erosive lichen planus tends to be the most painful. Um, and these patients really can't clean these areas. They really have to change their diet in some cases and only eat soft foods because they are so sensitive. We've been effective. We've shown promise in about 8 out of 10 lichen planus patients are getting some type of relief from our products. So some get more relief than others, but if you can give these patients any relief at all, especially if it's coming from a natural product that doesn't have any negative side effects, you've really given them something that they can utilize long term and really make them more comfortable. And that's the name of the game when it comes to these patients. So this is just 1 week after using our rinse and gel. You can see that this patient reacted very, very well. And then in these cases, we would recommend that the patient just continue using our rinse on a daily basis. And then when they have a breakout come up, then they just use the gel on that area until it goes away. Another another case, one thing that I haven't really talked about yet is cancer patients. Um, we are really expanding into oncology as dentists will recommend our products to their patients that maybe are about to start chemotherapy or are already going through chemotherapy. I just had a call last week from a doctor that said an oncologist reached out to them because one of their patients is going through chemo and went for a checkup with their oncologist. The oncologist, once the patient opened their mouth, the oncologist was really, really surprised at how healthy the mouth looked. And that's really what we encourage for these patients is actually to start using the StellaLife products before they start chemo. And it should really help prevent this in most cases, mucositis and thrush. But if you do ever see these things, know that the StellaLife products can effectively reduce these symptoms. This was 1 month after using our recovery kit. And as you can see, this patient's probably pretty sensitive, so you would want to take out that peppermint rinse and just replace it with a coconut rinse inside that recovery kit. All right, so getting into probiotics. Probiotics, this is a really kind of a new thing. That's You see a lot of different probiotics hitting the market. Most are really focused on your gut health, which is so important to your overall health. I firmly believe if you have a healthy gut, most likely you feel overall pretty healthy as an individual. I don't know of a company out there that has combined both a oral and gut probiotic in the same kit. So this is dentistry. Obviously, we wanted something that was going to positively affect the oral microbiome. But also, since the gut and the oral cavity are linked, we wanted something that would also affect the gut as well and really help to improve a patient's whole body health. So, this is a very unique probiotic. We have a very diverse amount of strains that are found in our probiotics. Unfortunately, I think I opened one of the old presentations, so this doesn't show the updated amount of strains that we have. But in our spore probiotic, This is our gut probiotic. It just comes in a capsule. Um, Spore strains is really what you want when it comes to a gut probiotic, as spore strains are much more resistant to stomach acid. So you know that these strains are really staying alive. They're getting all the way to your colon, and you're getting maximum absorption and really the full benefit from this. This is also a postbiotic, so postbiotics are once these die off, this is what's released afterwards. So it really helps all of the living bacteria to be more effective. It would be like, drinking a protein shake after a workout. It just, it makes the effects of that workout better, just for your muscles and everything. But this is again just a capsule that you swallow. This has 17.5 billion CFUs and six different strains of probiotics. And then our oral probiotic, this has now, instead of nine strains, it's 11 strains. We just came out with a new formulation that now has 11 strains, just based on the feedback that we got from experts in the industry. We changed it up just a little bit. But our oral probiotic also has zinc, vitamin C, and vitamin D, as we know are very vital to overall, immune support. Um, but I would say, just kind of as a differentiator in the industry, there are very few oral probiotics that have the same amount of strains as we do. And just showing you, overall 17 different strains between the oral and gut probiotic. It is different strains, in the gut versus the oral. But just a few that I'll talk about real quick. I don't have time to go through all of these, but we have made all of the research that we use to develop these products available to you guys. This is all available on our website, along with all of the other research that I've talked about today. On our research tab on our website, you can find all of these studies. But for instance, Streptococcus salivarius, very effective at reducing certain types of periopathogens, and really inhibits immune activation by periopathogens, which is like inflammation, for instance. So, inhibiting inflammation from happening in the first place. Some of the others are really effective at reducing strep mutans. Some have these really strong antifungal properties, such as Lactobacillus reuteri. So, um, just a very wide spectrum, very broad spectrum of strains here, and each one of these strains is doing something different in the mouth. So they're all very important, and I would highly encourage you guys to look into this just in a little bit more detail. The mouth, or sorry, our rinse can only go so far. It is antimicrobial. It's killing the bad bacteria, helping your commensal bacteria survive, but it's not delivering new strains of good bacteria to the mouth. So this is an added component along with our rinse. I think, if you're prescribing this post SRP or post or just for like a gingivitis patient, or say someone with halitosis, for instance, this is something that they could utilize for a long term, for instance, for like patients taking medication that's drying out their mouth. This is neutralizing the bacteria that cause halitosis. So this could be a long-term solution for those patients, and really a preventative, preventing things like gingivitis from happening down the road. But also anyone taking antibiotics. I think this should become a standard for anyone prescribing antibiotics, is also prescribing a probiotic along with it. As we know, antibiotics are just wiping out all of your good gut flora, exactly like chlorhexidine does in the mouth. Um, and it can take the gut quite a long time to recover and rebuild all of these good bacteria levels in the gut post-operatively, if they're not using a probiotic alongside the antibiotic. If they are using a probiotic, this process happens much, much faster, and should, alleviate any of those negative side effects that your patients are getting from antibiotics. Also, SRP patients, obviously, these patients are suffering from a imbalance of bacteria in their mouth, where bad periopathogens, there's a much higher population than their good commensal bacteria. So this is going to help deliver new good strains of bacteria to their mouth, and really help fight off and reduce these bad periopathogens and get these patients to a state of remission much quicker. Um, but really interesting case study. This one came from a periodontist. That's one of our customers. They wanted to see, you can see that this 29-year-old female presented in pretty bad shape with gingivitis. And just looking at her chart, she had, pretty deep probing depths on average of around 4 millimeters. Her plaque index was around 50%, and bleeding on probing was around 90%. So they wanted to see, what could the StellaLife probiotics do just by themselves without any of the other StellaLife products. And you can see just after 6 weeks, what we've done for this patient. She actually reported at this 6 week follow-up that she felt healthier overall. And then at the 4 month period, you can see a complete 180 just in the overall look of her oral health. But her proving depths reduced to about 2.5 millimeters on average. Plaque index went from 50% to 4%, and bleeding on probing from 90% to 7%. So definitely some more good case studies and just studies in general that need to come out on our probiotics. We have a lot in the works right now that we're really excited to share with you guys once those are ready. But again, this product is growing very, very quickly. A lot more doctors are really starting to realize the benefits of probiotics. Um, but the gut probiotic, as I said, comes in that spore capsule. You just swallow that with some water. And then with the oral probiotic, the key is letting it dissolve, so no chewing on it, and then waiting about 1 to 2 hours before eating or drinking anything. So if they were, using the rinse first, then they could, pop this in right after and then wait about an hour before eating or drinking. And it's a strawberry flavor. I know some of the other probiotics don't taste very good on the market. Ours does taste pretty good. I mean, it's not like a Sour Patch Kid, but it is pretty tasty. It does not taste bad, and we don't really get bad feedback on our flavor. And then this is the last product that I'll talk about real quick is Dentamedica. Dentamedica, as we know, vitamin deficiency and especially vitamin D deficiency is such a major issue in our country. Roughly 80% of patients over the age of 35 are deficient. Now, some are a lot more deficient than others. I think, 50 is where you want to be at. A lot of patients are in the 20 to 30 range. Some patients are even under 10. So these are the patients that we really need to worry about. If you don't have adequate amounts of vitamin D in the system, vitamin D is what pulls calcium out of the bone, out of the bloodstream and delivers them to your bone. So if we're trying to form new bone, say in a GBR or say an immediate implant placement, you need to have adequate amounts of vitamin D. And this isn't just a hypothesis. They've actually proven this in uh, different studies that have happened over the past number of years. In one of these, they had about 300 patients where that experienced an implant failure. They wanted to see if there was a common theme amongst these failures. And what they found was that with the majority of these patients, some of them had a deficiency, like major deficiency. As I said, some were a little bit deficient, but there is a strong correlation between vitamin D deficiency and early implant failure. And there's been cases where a doctor has done a surgery, they weren't seeing any mineralization around the implant placement just in the 3 month follow-up. Redid the surgery, again had a failure. Tried Dentamedica the third time around, and miraculously, the third try, third time's a charm. But really, the doctor thought that due to the use of Dentamedica, was the reason why the case, was a big success. And so what I would highly encourage, reviewing these studies. These are all available on our website, um, and so you guys can easily go get them from there. But this is more than just a vitamin D supplement. This is a very comprehensive vitamin supplement. So I take this as my daily multivitamin. We do encourage it. This covers, if you were paying for all of these vitamins by themselves, it would be a pretty big expense. This is just $42 and retails for 60 to the patient. But it covers your D3, E and K2, which, make your D more effective and the absorption of your D more effective. If you're just taking D, you're only absorbing about 40% of what you're taking, but also vitamins A and C, all your B complex vitamins, your metals, magnesium, zinc, copper, magnesium, potassium, sodium, even your CoQ10, so your antioxidants as well. So this is covering a lot of different things, and this is made in the U.S. It's non-GMO, and it's made in manufacturing facilities that have this GMP, Good Manufacturing Practices designation. This is a vegan-friendly supplement, so all of our sources are from plants, such as our D3 is coming from lichen, and as we know, absorption from lichen or a plant a plant is going to be better than from an animal source. And usually D3 is coming from sheepskin, in case you didn't know. But this is a mega dose of vitamins. So it's 5,000 IUs. It's really a loading dose. And the patient, ideally, before their implant surgery, starts 4 weeks before and continues 2 weeks after. So, and if they're severely deficient, they can start up to 8 weeks before. Um, and I know I'm coming up on the hour, so I'm going to speed through these last few slides. But as I said, 4 weeks before ideally, and then continue 2 weeks after. This completely gets them through their bottle. And if you're just taking it as a daily multivitamin, you just want to take one pill in the morning, one pill in the evening, with some food. And then if you're taking four per day, you just want to take two in the morning and two in the evening. Always want to take it with food because it is a lot of vitamins. Um, and then one really cool thing about StellaLife, we have this really cool tool on our website called Find My Provider. Patients can go on here, type in their zip code, and see the nearest clinician that is dispensing StellaLife. You guys can sign up for this, so you will show up when a patient types in their zip code. And I have actually heard from some of my customers that they have gotten new patients from our website. So not only are we helping with your healing, we're helping you get new patients as well. So a lot of benefits to that. But um, I will tell you guys real quick, as far as pricing goes, if you're buying in bulk, every single one of our products is sold in cases of 12. You clinicians get a 30% discount year round, no matter what. And this is a 100% guarantee. So if you get, a case of rinses, you try it out, you don't see the results that we think you'll see in your practice, and you want to return the products, we will completely refund you. I can tell you that really doesn't happen, because we are so confident that you will see a difference with our products. But 30% off retail on all of our products year round. And then what most of our doctors do is just make this part of the treatment plan, exactly like you would with chlorhexidine. But making these products part of the treatment plan, not really even giving the patient an option, because it's really going to be conducive to their overall healing and the outcome of the surgery. And dentistry is all about predictability. So if we can have more predictable healing results, it's going to be better for everyone. But thank you guys so much for your time today. I really appreciate it. Are there any questions for me? Yeah, and so for participating in the training today, everyone can get a free product sent to them. So I'm not really sure who to reach out to.
Hey,
If you guys reach,
Cliff. This
yeah,
is Rachel. I just put it in the chat, but
perfect.
we appreciate you all for joining. And Cliff, thank you for that great presentation. For our clinicians that were able to join us, we have an email address that we just asked that you send an email into with your mailing address. So that way we can send you complimentary full-size product. That email address I put in the chat, but it's info@stellalife.com. And then it looks like we have a few questions here in the chat, Cliff. One of them is, what do you have for bad breath?
Yeah, so bad breath. As I said, it's a combination. It would be a combination of our rinse and our probiotics kit. Probiotics lozenges especially, but the mouth and the gut are linked, so it can the probiotic strains in our oral probiotic are neutralizing the bacteria that cause and the funguses that cause bad breath. So a really good combo, and I've read some reviews on Trustpilot, for instance, that say, I just use the probiotic as a breath freshener throughout the day. Like as soon as it dissolves, you let it sit there for 30 to 45 minutes. It's really helping to freshen up the breath because it's neutralizing the bacteria that cause bad breath. Next one. Can we get access to the recorded presentation? Absolutely. Rachel, how will they do that?
Yes, we will be following up via email with the link to the recorded presentation. We'll hopefully get that out either by end of day today or tomorrow morning, depending on how quickly we're able to download and upload it back up.
Perfect. And then the age range for the vitamins, we say 18 and up is usually what we recommend. Um, and which products for implants, like Implantus from Gennady. So yes, for implants, we recommend the recovery kit, all three products in there, and then like Implantus, which I talked about earlier, but the rinse and gel, if it's a really bad case, then we recommend the recovery kit until they get that under control, and then they can just go to rinse, either rinse or rinse and gel once it becomes less severe. And then also for lichen planus patients, the probiotics would could be very beneficial as a lot of these autoimmune are more systemic. So we've shown a lot of promise using our probiotics for these patients as well. What are the shelf life of our products? Sorry, I forgot to mention this, but yes, the shelf life on all of our products is 2 years. If anything ever expires on you guys, we will replace it for free, no questions asked. So don't think that just because you're going to go through, oh, looks like someone's drawn on the screen here. Just because you think you won't go through a product as quickly as say our rinse, say you only want to use Dentamedica on certain patients, still get the case, still get the discount. And if it ever expires on you, we will replace it for free. But I guarantee once you start using it, you'll see a lot more opportunities to use it in your practice and you'll go through it pretty quickly. More specific ingredients in your rinse. Yeah, so all of our, I'll actually go to our website real quick. So on the StellaLife website, guys,
And Cliff, as you're pulling that up, I see a few questions in the chat. So again, as a follow-up to request your free complimentary full-size product, you can just send an email to info@stellalife.com. So that's info at STELLALIFE.com. And just provide your name and your mailing address, and we'll send those products out to you.
yeah, so if you're ever questioning, what are the active ingredients in our products, you can easily go to our website. We do also provide a clinician's guide to any new customers, just a laminated sheet with all of the active ingredients in all of our products. But as a derecha, indica, calendula, echinacea, and plantago, a lot of these have been used for hundreds of years, and they have a lot of research backing up their effects individually. Now we've combined them all in the same product, and the synergistic activity of these ingredients is even more effective. And that's really what we've seen with our ingredients. If you're interested in, doing your own research on the different active ingredients, feel free. All right. Let's see. Are there any other questions? Let's see here. We are a pharmacy that stocks for dentists. Do we get a discount too? Yes. Any pharmacy, any independent pharmacy that stocks the products get the same discount as dentists. There's some doctors that, never want to stock products in their offices. We understand that, and the workaround that we have is just working with an independent pharmacy near you. But yeah, if you guys are a pharmacy, you always get that same 30% discount. And I think,
Faye, it looks like you have your hand up. Did you want to unmute and ask a question, or is your question the one that was in the chat? And for those of you that are still with us, please feel free to unmute and ask your questions if that's a little more convenient than putting it in the chat.
already answered. All right. I think we're good.
Fantastic. Well, thank you, Cliff. And so we do have another webinar that's coming up. We're doing one every month, but next month is a little bit different in the sense of content and format. So we will be sending a follow-up email, but what we're looking at is September 17th, which is a Wednesday. That would be a little bit later of a program. That's at 7 o'clock Central Time. What we're going to be focusing on is we're going to have Liz Lundry with us. She's a product specialist as well. And she's going to really be focusing on Dentamedica and probiotics, and not only the products, the applications, but also indications and how you can be using it to really enhance your patient care and their patient experience. Again, we will follow up via email with the links to this recording. And if you have any questions, feel free to email us at info@stellalife.com, or we also have another email address, support@stellalife.com. Once again, if you are interested in taking advantage of those complimentary full-size products, please reach out, send us an email with your shipping address, and we'll get those out soon.
All right. Thanks, guys. Really appreciate your time today and have a great rest of your week.
Take care, everyone. Thank you for joining.